The anatomy of an orthokeratology lens. So in this video, we will break down the components of an Ortho-K lens and explain how each dot corresponds to each adjustment. So how does modern orthokeratology work? The change of corneal shape is not due to the mechanical pushing of the orthokeratology lens, but rather it is the fluid forces created by the fitting relationship of the cornea and the lens. This is called the squeeze film force. The positive inward force results in a slightly thinner central corneal epithelium, whereas the negative outward force results in a thickening of the mid-peripheral epithelium. This is a wave night lens design based on the VST template. So we can customize this lens design through the modification area. Breaking down the night lens, there are 4 main adjustments that can be made using the modification tools: the alignment zone, reverse zone, base curve, and optic zone diameter. We will go through each of these in detail. Alignment zone. In other lens manufacturers, it is known as the landing zone angle. This zone is responsible for the alignment to the peripheral cornea. It is clinically seen as the peripheral corneal bearing and the ring of fluorescein on the edge, creating the semi-sealed environment. In the modification area, we can modify the alignment zone by increasing or decreasing the sagittal depth in microns. To increase edge lift, we will decrease the sagittal depth. This refers to the overall sagittal height of the lens. This will move the pink dot up and vice versa. The alignment zone has multiple purposes. First, it is for the lens centration. It is also to ensure that there is an even distribution of the fluid forces around the lens. And lastly, to create a semi-sealed environment, allowing for the hydraulic forces to take place. Clinically, the zone is for superior, inferior, or lateral decentration. And it also plays a small part in excessive central clearance. In this zone, it is highly specific, so we can modify the alignment zone in 5-micron increments in the modification tools, and it can be specified to the whole lens, half of the lens, or quarter of the lens, giving us 8 semi-meridians that we can customize. If you want more or less than the 5-micron steps, you can use our manual modifications. The reverse zone. This zone goes by many names: reverse curve, fitting curve, or reverse zone depth. It is responsible for the negative outward force, which creates possible migration of the central epithelium and/or enlargement of the peripheral epithelium. This is created by a return zone that is steeper than the curve of the cornea. Clinically, this is seen as the pooling of fluorescein. In the modification area, we can modify the reverse zone by increasing or decreasing the sagittal depth in microns. This will move the blue dots up or down. The purpose of the reverse zone in wave is to increase or decrease the apical clearance, which helps to generate and sustain the hydraulic forces. Clinically, if you see pooling centrally on your lens, decreasing the sagittal depth in the return zone would help. If the decreased vision is due to a patchy treatment zone, then most likely it is due to the pooling of the fluorescein. That creates an uneven treatment. Similar to the alignment zone, in our modification tools, we can adjust this zone by all, half, or quarter modifications in various micron steps. This zone can also be manually adjusted in 1-micron steps in the 8 semi-meridians. Base curve. The next parameter we are going to talk about is the base curve. The base curve has a few names that you might be familiar with: the base curve radius, back optic zone radius, or the treatment curve. This area is responsible for the positive inward part of the squeeze film force. By having a base curve radius that is flatter than the curve of the cornea, this creates a fluid force that results in central epithelium compression, as indicated by a topographic flattening. Changing the base curve does not change the fit of the lens. Therefore, if the fit is not perfect, then that should be accounted for first. For new fitters, we want to start with a uniform spherical base curve to avoid any possibility of asymmetric treatment, leading to induced astigmatism. By using our VST template or any modified templates, it automatically defaults to a spherical base curve. In this modification area, we can modify the base curve by steepening or flattening the base curve in 0.25 dioptric values. This will be bringing the physical red dots up or down. The main purpose of this parameter is for the correction of myopia and astigmatism. In this area, once the fit of the lens is perfect, an even treatment zone is seen on the difference map. Additional myopia correction that is needed can be accounted for by using modification tools to increase or decrease the treatment in 0.25 diopter increments. If there is under treatment by 0.25 diopters, then we can flatten the lens. If there's an internal astigmatism that is seen even with the best fitted lens, WAVE is able to correct for internal astigmatism by using base curve manipulation. However, every case is different, so you can refer to our correcting internal astigmatism video to determine if that is the right next lens manipulation for you. Optic zone diameter. So next we are going to talk about the optic zone diameter. This is also known as the back optic zone diameter. This is depicted by the red dot, and it's responsible for the size of the treatment zone, which is seen as the absence of fluorescein on the eye. The purpose of this modification is to create a treatment zone with the desired diameter, depending on your treatment goal, whether it is myopia correction or myopia management. In this modification area, we can modify the optic zone diameter by increasing or decreasing the size in 0.1 millimeter steps. This will be bringing the physical red dot left or right. The WAVE software will also automatically change the IC diameter accordingly to maintain a difference of 0.6 millimeters between the IC and the OZ. The main purpose of this parameter is for the correction of myopia and astigmatism. The zone can be modified in 0.1 millimeter increments. A smaller optic zone is suggested if myopia management is the goal. Clinically, if there is internal astigmatism seen, even with the best fitted lens, WAVE is able to correct for the internal astigmatism by using optic zone manipulation. However, every case is a little different, so you can refer to our correcting internal astigmatism video to determine which method is the next step for you. With WAVE, an oval optic zone is possible manually, whether it is for the purpose of the fit of the lens or myopia correction. The last dot in the Orthokeratology design is called the edge. This is the physical edge of the lens, and we do not use it to help manipulate edge lift. Therefore, it is not listed in our modification area. The purpose of this dot is to enhance tear exchange. Just to recap, these are our 4 main modification tools for an orthokeratology lens. We will teach you how to use these modification tools more in depth in a later video. Let's put everything we learned together on one slide. So there you have it. This is the anatomy of an Orthokeratology lens integrated with the WAVE software.